One of our major concerns from the House Republicans and Senate Republican caucus was that this was a hugely contentious and controversial bill to take up in a pandemic session when we are virtual. We had just gone through the last session with over 5,000 people attending and 22 and a half hours of testimony. So though we had experience with it, we knew it was going to be very contentious and thought it really deserved to be done in person. The second part of that is that we feel that our focus really should be on COVID and pandemic related issues, be they public health issues, economic issues, and especially small business issues. And obviously you're all well aware, you've been dealing with this every day just like us. There's many issues to deal with. So be that as it may, we had concerns about doing this in a virtual fashion. And as we got into the meeting here, I guess the proper adjective is disappointed, because I thought the major players we needed to hear from were the Department of Public Health, particularly the epidemiologists and the people that deal with the collection of this data so that we could set the stage for what the issues were, and the State Department of Education, which would have to deal with the fallout in terms of policy and if students were removed from school. And as you all saw, we had really nobody. We saw the written test. I've seen the written testimony from Acting Commissioner Gifford. I haven't seen education testimony yet. It may be up, but as I said, only less than a third of the testimony had been posted because of the voluminous nature of it all. In addition, none of the leaders up here, well, none of the leaders virtually appeared. There's a number of people in leadership who have been pushing this bill for a number of years, and none of them testified to give us their philosophies and why they thought this was a critical issue.
What I believe we have experienced over the past 24 hours is really a disregard for the deeply held traditions of Connecticut and the time-honored foundations of our country and the process to be heard as a citizen. And the process that the Democrat majority on this committee had decided on to prematurely, in my opinion, end this hearing, where nearly 1,500 people were not allowed to speak, does not honor the right to petition our government and to be able to have your grievances heard and your opinions be heard.
That I was really eager to learn and hear testimony from all the impacted shareholders on this issue. That's what we do in a representative government. That should be for the people, by the people. And I think you saw that emotion come out for all the people that were able to speak. But they were also very sensitive to many others that weren't able to speak. So no matter where you stood on this issue, there was only one loser today, and that was the ability to have a transparent and representative government.
We had talked about this at the beginning of the public health committee process, talking about the focus should really be on bills that are pertinent and necessary to get through COVID, to do things like expansion of telehealth, to make sure medical assistants can administer vaccines.
All of us, before you really felt strongly about not doing this hearing virtually, we felt like it was far too controversial to do that. And, they proceeded, and I say they proceeded, obviously we're outnumbered, so the majority voted to proceed with this hearing in this manner. And then we were then limited to 24 hours, which really put even more restraints on it. And I think you heard the numbers, 1,931 individuals signed up and 236 people were heard. 10 of those supported the bill and the other 226 didn't.
What has been said about reading the testimony, for all of us to spend 24 hours and only hear 226 people be able to speak and give their opinions, leave 1,500 unable to do that in the waiting room, and then expect us to be able to read through and digest 3,500 written testimony in a short period of time on a highly controversial bill that if you were listening over the last 24 hours, you would clearly see that there are so many intricate details and issues within this legislation that just have not been flushed out. everything from the way nurses report vaccinations, what are the schools going to do in displacing these students? How does the process work to expel a child? Excuse me. So there are very many issues that we haven't even touched on.
This is very complicated, trying to do this remotely, to sign up thousands of people and send them links to be able to sign in. And given 2,000 people, we'd likely need to have this set up for 4 or 5 days. So it would be difficult. We maybe could have gone a few more hours in this, but then we run into other committee meetings. We lost some people for a few hours yesterday during other committee meetings, but we would run into other committee meetings as well. So some of the logistics proved difficult, which is again another reason why we thought we should wait until we could do this live, which wouldn't take away from the amount, but I think would make it a little less prone to the technical glitches that we had intermittently. I mean, I think the staff did a superb job trying to wrangle the hundreds of people and the links and getting people on, but it's a very complicated task.
Wanted to hear everyone who signed up. We wanted to hear their voice, and the only, the chairs can't decide how the meeting is going to end. There has to be a vote. So it was important for us to say, look, we are willing to stay. We are willing to hear every voice that signed up to testify. If we have to do it over a course of 4 days where we limit, we recess and we come back for 8 hours every day until we can hear every voice, we thought that was important. And we were hopeful that maybe some of the newer members of the committee on the other side would also see it that way, how important it is to have everyone's voice be heard.
There's a lot of confusion over this, and I would have preferred to have people get together and work up to trying to find common ground, if not this session, next session. And I think what really was troublesome is when we all saw Senator Duff's Facebook page, I sat there and I said, how can any of us label somebody who we don't even, one, know? And two, I thought they were very honest and genuine. I never thought about stereotyping or labeling people. And if we want to improve the communication and respect in the public sector amongst public officials, then we have to lead by example. And that unsolicited and unprovoked response, I thought, was very extremely disrespectful. And it certainly is going to make it very difficult for the public to believe that what they're saying is being treated seriously or in honesty.
I thought it was disturbing. Public health is not a partisan issue. That was brought up by other members during the committee hearing. And the fact that you have high-ranking officials in a party demeaning or using demeaning words during a hearing on a similar subject really is, it's extremely disappointing. It's inflammatory.
We saw it throughout the entire evening, was disrespectful, and people felt as though that they were insensitive to the concerns that were raised. And that really was what made an impact on me, that this was a democratic process that was a fait accompli, and that people were disrespected and not given an opportunity to have their voices heard in a, quote, public hearing.
Many of the people that testified felt like many of the members had predetermined that they were in support of this bill, and some of that was based on a couple of the members early on saying that they were committed to passing this legislation.
But when I looked at everybody who testified last night, kind of to an earlier point, I remember early, I guess yesterday morning, one woman, she came right out and said, I am a progressive feminist. And then we heard from people who were really very religious, that quoted Bible verses. So to me, it was a whole range. There was not one certain type of person that testified. This was all across the board. And I hope legislators are open-minded to listen, especially when over 1,200 people were not heard.
To call them anti-vaxxers and to kind of create that social demeaning on social media is very dangerous, and it is not productive to a positive process. It's a chilling effect on people practicing their protected constitutional right. So I wanted to point that out. That was one of the chilling effects I saw from people's reaction, that despite their concern, despite their potential ostracization, they still came out, spent 24 hours with us, and they spoke passionately.
And we talked a lot about respect, and ranking members have certainly said it. We talked a lot about respect, but respect isn't just in a word, it's in the tone that you use when you speak at colleagues. And I sensed a good amount of time, the people that were speaking were very passionate, they were emotional, and at times they were being attacked by a tone of voice that was unsettling for me.
We made history today, one, for having the longest public hearing, and two, which wasn't so positive, we weren't able to hear all the residents of Connecticut, and that was disheartening. I think that was insensitive to our residents that came and waited and should have been heard, and we wanted them to be heard. We could have split this hearing up in many different ways. We could have recessed and could have come back 8 hours or the next day. We could have done a few days in a row, but the leadership of the Public Health Committee didn't want to do that. So I'd like to thank all the people that did stick it out, and our members and the community and the residents of the state of Connecticut that had such thoughtful and passionate thoughts on this.
I think the 24 hours, if it told us anything without getting into details, is that this proposal is incredibly complex, has multiple consequences, social, medical, financial, that we've only begun to scrape the surface on.